everyone. We're now going to go through some level 1 exercises for the knee. Primarily these exercises are designed to facilitate muscle activation in and around the knee as well as the hip itself. One of the problems that you've probably already discussed with your therapist is the fact that your knee is probably deviating a little bit inwards, or you're just lacking that ability to control your knee through normal movement. So that's what these exercises are primarily designed to help you with. So we're just sitting down. You'll notice I've got the TheraBand tied in a nice simple loop around my knee. For these examples I'm going to show you using the TheraBand. Of course, if you're not up to using the TheraBand yet, you just do the exact exercises that I've given you, but without the TheraBand. So the movements will be a lot simpler, obviously, with less resistance and everything like that. So the first exercise we're going to go through we call the clam. A lot of people have seen this one before, but it's very specific in how we want to target the glute medius muscle and control that external rotation of the knee. So basically we're laying as if we're laying up against a wall. So imagine we've got a wall at our back. Ideally we do it with a wall there, but for the filming of this we want to try and do it on a table just so that you can see everything easier. So our feet would be against the wall, our backside's against the wall, and our shoulders are against the wall. Our knees are at just a nice bend to 90 degrees with our hips at a comfortable angle, and we're right up on our side there so that we're not too rolled backwards or too rolled forwards. From this position, keeping the feet together, we just very gently lift the knees apart like so, up and down just like the mouth of a clam. As that sort of opens and closes, you can see the band's obviously stretching. That's providing a degree of resistance. And we just lift as high as we can without actually rolling our body. We don't want to roll that body back because obviously that's going to be quite sort of counterproductive in that you're moving but not actually stabilising whilst we're doing it. So this teaches our hip and glute muscles and everything like that to be stable without any sort of twisting or anything through the back and any sort of detrimental problems that can happen with that. So that's the first exercise, and you'll do the required number of reps, which will be kind of outlined in your sheet or informed by the therapist. But normally we keep this anywhere from 10 to 12 right through up to 20, just depending on what we're trying to achieve with this exercise. All right? So that's the first exercise. From this one, there's a similar one we call the lateral leg raise. Now with the TheraBand wrapped around the legs, we keep the bottom leg bent and straighten that top one just to kind of give us some better tension of the band and give us a better angle. If you don't have the band, you can always do it with two legs straight, but I prefer to do it with the bottom leg bent. Just gives us better stability. Still laying on our side in a nice comfortable position. The key with this is to not let your toe point towards the ceiling. As soon as your toe points towards the ceiling, you're going to use muscles around the front of the leg as opposed to using the actual glute muscles that we really want to target. So as we do that, try to just keep your toe pointing slightly towards the ground, so leading with the heel, and then we just gently lift up into the air like so. And as we do that, we can see the band sort of stretching. It's providing a degree of resistance, making us have to drive backwards on an ever so slight angle rather than going straight up or coming forwards like so. We've got to make sure we're going at least vertical, preferably a little bit further backwards. And as I do that, I can feel that really targeting my glute medius muscle through that upper glute area and really making sure that my glutes are working to help stabilise that whole movement. All right? So that's the lateral leg raise, a very good exercise, very important for us to be kind of stable whilst we're doing that. Now the next exercise we call the glute bridge. Now there's a number of different variations of the glute bridge. So it starts with a very simple two-legged version where we're just driving up and down like so. The key with this is make sure we push our heels into the bed or into the floor. Okay, so you notice when I do this I can lift my heels right up as we sort of create that better sort of drive using the glute muscles. Sometimes if we go up on our toes we tend to use the quads or we slip or move a little bit. So just make sure we're focusing on pushing through the heels, and then as we drive up, keeping the back and all that nice and tight, not arching the back or tucking under. Keep really sort of neutral as we come up and down, and it sort of helps us with that movement. We can have our hands at our side there just to control basically our balance. Okay, and if you like you can come up, hold for a couple of seconds and back down. Now if you've got a TheraBand, the key is to try and keep your knees at a reasonable width, about hip width apart, so that our hips, knees and feet are at the same distance, and the TheraBand's actually trying to pull our legs together, and that makes us engage more of the glute muscles as we do this exercise. It's quite a good one as we come up and down. Then, to progress that, from that we call it the glute bridge 2-1-2, okay? So essentially we're going to come up with two legs,
go onto one leg, back onto two legs, and then back down, okay? And then we come up, onto one leg, back onto two legs, and then back down. So we can vary the side that we do if we like, depending on what you're advised by your therapist. You may just want to do up and one leg only, okay? And then back down, and just keep working that one side, or your therapist may want you to alternate depending on what we're trying to achieve in your individual case. Alright, so just pay close attention to what you're advised there, and then you'll know exactly what you need to be doing. And the last variation of this one, again with or without TheraBand, it doesn't really matter. This one is what we call the single leg glute bridge. Alright, probably one of the more harder exercises out of this group, but nonetheless it's a very important one to help stabilise through the knee. So as we come up with the single leg one, we straighten one leg out, driving through the heel, and then we come up with the one leg, holding up there for a second or two just to really feel that glute work, and then back down again. And then we can swap it over and drive up again, holding, and then back down again. And your holds can vary, the repetitions can vary, and the sets can vary. So that will be dependent on what, again, you're trying to achieve given your current condition. Alright? Again, with that one, we can either come up with one leg and then back down and do the same leg over and over again, or we may want you to actually alternate just depending on what we're trying to achieve. Alright? Now, another exercise for us to do is what we call the bird dog. So we call this the bird dog kick out. Your normal bird dog, we come straight back, but with the bird dog kick out, we're actually going to be going out on a 30-degree angle or so. So the way to find out what angle you're going to be on, again in that nice hands and knees quadruped type position, you see my neck and everything's in a good stable position. We're not kind of arching up or dropping down or swinging our head around anywhere. We're in good solid position, and then we drive straight back, and then we come out on an angle until we get to a point where we start to really feel the upper glutes working. If we go straight back, we'll feel glute max, and then as we come around, we'll get more of the lateral stabilizers, which is what we're trying to target with this exercise series. So as we come straight back like so, we go around to the side there, and now I can really feel that working my glutes, and then we come in, tap the other knee, back out again. In, tap the other knee, and then back out again. And you can see that angle is out quite wide there compared to being straight. So it's from here, we actually come out on that angle, and away we go. Now the other key with this exercise, and something that's really important to remember, is that our toe stays quite low. We're not trying to lift up into the air or raise up too high, because you'll notice if we do that, my back arches, okay? We want to keep our back and our core and everything like that under control so that we're in that perfect position as we go in and out like so. And that way as well, if we keep our foot low, you'll notice the TheraBand just stays in the right spot. If I try to come up too high, there's a tendency for this to want to roll up my leg, which becomes awfully uncomfortable, okay, and again defeats the purpose of having the band there, which is making life a little bit more difficult for us in terms of adding extra resistance into the exercise. Alright, now we're almost finished, a couple of more exercises to go. This next one, okay, is what we call a long arc or a short arc knee extension. So it just depends on what we're trying to achieve and how much range you have of your knee. So the short arc is where we're just focusing on that last little section of the knee extension. Okay, you'll notice just sitting on a chair or the lounge at home, we can do this because we don't need to bend the knee very far. Notice I'm standing on the TheraBand to add a little bit of resistance. For those people who don't need the TheraBand or aren't using the TheraBand yet, you can just do it without, obviously, and just focusing on that last little bit of movement in order to fire up the quadriceps. So this is really targeting those muscles. The big thing to remember with the short arc or the long arc is just coming from a lower point. You can see that's a much longer arc that I'm going through there as opposed to just that last little bit. You see with the short arc or the long arc exercise, the key is the last 2 to 5 degrees of the movement. So if you just do the movement where you just come up to there and back, where you're not quite getting fully straight and really locking your knee as straight as possible, you're getting benefit, but you're not getting the full benefit. And the key with this one is to get that last little bit of straightness
which really targets all of your quadricep muscles and really makes sure all of them are working. Now again, with this one, there's a number of different variables where we can do different types of reps, and we can hold there for different times and everything like that. And your therapist will outline those numbers for you specifically, and how many sets and all those types of things. So they're the important things that we just need to monitor at this stage. Alright? Now the last exercise, which is your hamstring curl, I've just come around here. So the hamstring curl, classically, we like to put our knees up against something, or one of our knee, the knee that we're targeting up against something, just to stop us wanting to move the knee forward and start to sort of do this type of movement. And we're endeavouring with this one to try and keep our knee nice and straight. Now you notice I'm just standing on the other side of the TheraBand there, trying to keep that anchored on the floor. This way we just use the same TheraBand for all these exercises rather than having multiple types for different exercises. So I just push my knees against there, so I walk in close enough. Now again, I'm just using the table. You can use a kitchen table or a chair or a desk of some description where you can actually hang on to something here for balance. Alright? Now in this instance, you'll notice basically we just have the TheraBand wrapped around the ankle, knee against the table, and then we just very gently bend up and down like so. And you can see that there, because my knee's pressing against the table, it's actually targeting that hamstring there as we go. Coming up to about 90 degrees, okay, and you really feel that working that muscle, let me tell you. And we go up and down like so, just holding on to any tables or anything like that to keep yourself nice and stable, and that's going to really get that muscle targeted. Again, if you don't have the TheraBand, you don't have to, you just hit your knee there and we just let gravity do the work, and we come up as far as that we're required in order to feel that muscle working. Again, with this one, we can hold it for certain periods of time, we can change the number of repetitions, whether it's 10, 15 or 20 reps, and we can do different numbers of sets. But the key is to make sure that our body's nice and straight, we're well balanced, and we're just curling, only bending at the knee, not throwing the leg back or bringing it forward and moving like so. Alright, so that's our series for the level 1 about activating the muscle to help stop that knee deviating inwards as we're actually doing those movements. So be sure to get stuck into those, and if you have any problems, feel free to call your therapist or here at the clinic. Thanks.